Antibiotics are one of the most important discoveries in modern medicine. But did you know that using the wrong antibiotic or taking it incorrectly can actually make infections harder to treat? Today, we are examining two commonly prescribed antibiotics, Amoxicillin and Azithromycin. Which one is more effective? Which carries higher risks? And how does antibiotic resistance factor in? Have you ever wondered why your doctor chooses one antibiotic over another? Antibiotics treat bacterial infections, but not all antibiotics are the same. Amoxicillin is part of the penicillin family, which targets the bacterial cell wall. Azithromycin belongs to a different class called macrolides, which interfere with bacterial protein production. This difference is why doctors select one over the other depending on the type of infection. Did you know that taking antibiotics unnecessarily can contribute to antibiotic resistance, making future infections harder to treat? Even minor misuse can create resistant bacteria, which is a growing global health concern. Amoxicillin is often prescribed for infections like strep throat, ear infections, and urinary tract infections. It works by weakening the bacterial cell wall, causing bacteria to die. Azithromycin, on the other hand, is commonly used for respiratory infections, such as pneumonia, and for patients allergic to penicillin. It works by inhibiting protein synthesis in bacteria, stopping them from multiplying. Here's an interesting point. Amoxicillin usually requires multiple doses per day, while azithromycin can sometimes be given as a short 3-day course. Shorter treatment is convenient, but it doesn't always mean it's more effective. Have you noticed that some infections improve quickly but recur if antibiotics are stopped too soon? That's a scientific reason why completing the course matters. Both antibiotics have potential side effects. Amoxicillin can cause nausea, diarrhea, and allergic reactions in some patients. Azithromycin can also upset the stomach, and in rare cases, may affect heart rhythm. But beyond these side effects, the most serious risk is antibiotic resistance. Overuse or incorrect use of antibiotics allows bacteria to adapt and survive, rendering future treatments less effective. Imagine a bacterial infection that no longer responds to standard antibiotics, a real risk if resistance continues to rise. Do you want your treatment options limited because of resistance? So, how can you use antibiotics safely? First, only take antibiotics when prescribed by a healthcare professional. Second, always finish the full course as directed. Stopping early leaves surviving bacteria that can become resistant. Third, remember antibiotics are ineffective against viruses, like colds or the flu. Many people assume antibiotics cure every infection, but in reality, they target only bacteria. By following these practices, you reduce side effects and slow the development of antibiotic resistance, keeping these medicines effective for everyone. In summary, Amoxicillin and azithromycin are both effective antibiotics, but their uses, mechanisms, and risks differ. Choosing the right antibiotic and taking it correctly is critical for your health. Have you ever been prescribed either of these antibiotics? Did you experience side effects or incomplete recovery? Share your experience in the comments below. If you found this video helpful, please like, subscribe, and turn on notifications so you can stay informed about important health topics.